is, I don't know, 6 months ago, 8 months ago, or something like that. I'd had several people come to me and talk to me about different health center options and different ways to do things, and they were all kind of, quite frankly, somewhat similar. And then I'd heard, just kind of through the community, of the one that Rosen had, which is their own, basically their own health center. And I went up and met with Kenneth and Ashley. Carolyn, Sarah was sitting there, maybe, yes. And talked about them, about what they were doing and how they were doing things, and some of the savings that they're seeing, and some of the thing that was most appealing to me is actually it has become a differentiator in their business. Rosen Hotels, it's hospitality, if you don't know. One of the things that's really has struck me is we talk about retention here, and we talk about getting people to want to come here. The Rosen Group, and I hope I'm not out of school talking about your retention or your.
Yep, go right ahead.
Is that okay? Their turnover rate is about 14%, and up in that International Drive area, it's 50 to 60% or something like that. They believe this is one of their differentiators, or one of the things that makes their employees want to stay. So they've kind of, we've kind of met a couple times and talked about different things, how they're doing things, and if there's any opportunities for us. So if y'all would, I'll let you introduce yourself and then kind of not hear about me. Well, the other thing that kind of led them here is they've got a bunch of employees that live in Osceola County, whose students go to our schools, and it kind of became, I think, a little bit interesting to Mr. Rosen and these guys on, is this an area they can possibly do something? So with that, I will.
Yeah. Well, first of all, thanks for allowing us to come out and talk to you all a little bit about our healthcare program. My name's Ashley Bacow. I've been with the Rosen organization for about 20 years. Kenneth Aldridge, who's been there maybe a little bit longer. 21 years, and runs our medical center. And Carolyn Grant.
I'm the rookie.
Yeah, she's the rookie.
Yeah,
she's
5
been about
years.
5 years and runs our benefits division. As you all know, we'll get to the PowerPoint in just a minute. You know, healthcare is it's a mess, and there are a lot of folks out there trying to solve a drastic problem with subtle solutions, and it just doesn't align too well. It's completely unsustainable unless you are willing to do something just a little bit different. Mr. Rosen, about 27 years ago, we were fully insured at the time, and he was expecting to have a decrease at renewal time because he knew that his claims were significantly less than the premium that he was paying. And so when the insurance carrier came in and presented to him, not only it wasn't a decrease, it was a significant increase, he was very perplexed and said, you know, why is this? And they said, or he had mentioned, you know, I was expecting it to be less because of claims being less and that sort of thing. And they said, well, your claims were much less than what your premium was that you were paying, but the pool that you were in did not have good experience, and so that's why, because of the pool. And he said, I didn't know anything about a pool, and I don't want to be in the pool. And they said, well, there's no option there. You have to be in the pool. And he said, well, no, I don't. I'm out. And so at that point in time, we became self-insured, almost overnight, became self-insured, and cut a deal directly with the hospital, and so kind of cut out the middle person, and hired a part-time doc and a couple of assistants, and we were off and running. Now, we've learned a tremendous amount over the years. We didn't know anything back then. We've learned a lot over the years through vetting different type solutions, through just plain out stubbing our toes over the years. Never had a medical malpractice claim, and our costs are 30 to 50% less. And listen, I'm going to be talking specifically right now about the Rosen program. Not every program will be exactly like Rosen. Every culture is different. After hearing exactly what the needs are, you match the needs up to the right solutions. So some of the things that I may say may not exactly apply to your organization, but our costs are 30 to 50% less than an identical demographic that doesn't have the solutions that we have. So just your average demographic that's like ours, it's out in the conventional healthcare setting. So costs are 30 to 50% less, but our benefits are far, far superior to anything out there. And when you look at that graph, I don't have the graph, but when you look at a graph where your costs are going down like this and your benefits are going up like that, you go, who is this guy? Get him out of here, because this doesn't sound like it can be true. But it's our books are open to anybody that wants to look at it. It's absolutely so. We've gotten a tremendous amount of attention around the country, and we'll get into more details when we get into our slides of how credible it really is. We had before the Affordable Care Act, the Obama administration sent in a group of folks just to scrub all of our numbers and see if that might be a solution for the country and that sort of thing. And much like what happens in Washington, they kind of come down and they listen to you, but nothing ever kind of translated as far as we could see. Our on-site clinic, there are a lot of on-site clinic consulting companies out there. When you drive by our clinic at 30 miles an hour and you drive by one of the other ones out there at 30 miles an hour, they all look the same. But when you peel the layers of the onion skin back, ours is so different than any of them out there. It's truly, truly night and day. Now listen, the ones that are out there that you're seeing popping up over the last 10 or 15 years, it's a great step in the right direction, I think, but the savings are a tiny, tiny fraction of what can be obtained if you do it what we think is the right way. Mr. Rosen has two great passions, and those are health care. And again, he stumbled into that accidentally when he told the guy he didn't want to be in the pool and had to come up with a solution. But health care and education. And interestingly enough, the $340 million that we've saved in health care has helped us with his education initiatives. So I don't know if you know much about Tangelo Park, if you know much about the new Paramore program, but those kids all getting that free daycare and free college education. The Rosen employees who get free college education and their family members that get free college education. All of that is funded from the huge, amount of savings and a lot of other initiatives. He gives back to the community, and that's funded by the healthcare savings. So, why don't we jump into the? Yeah.
Make sure I'm not blocking you. Are absolutely fine. Don't you worry about me.
So our employees live in your community. We've got about 442 full-time employees in Osceola County, and then probably an equal number of family members there. We were taught by your teachers. Our employees' children are being educated by your teachers. Carolyn, what was that?
Yeah, I'll do this. Oh, yeah.
So I think I mentioned a little bit earlier the healthcare system, as you all know, is just it's a mess, and it's completely unsustainable unless you do something different. We're paying more and we're getting less, and it just doesn't make us feel good. So Dave Chase is a healthcare economist. He's written several things, but a couple of books. The most interesting one so far, I think, is The CEO's Guide to Restoring the American Dream. But he basically says if the if the CEO and the CFO and the board of directors don't understand healthcare, we never have a chance of fixing healthcare. They have to understand it. And I should have prefaced the whole presentation by saying we're going to get I hate to take up y'all's time. Y'all have got so much stuff going on, but this presentation gets very granular, and the reason why it's by design. I don't like that we have to do it that way, but I think it's crucial that you understand the problems in order to be able to buy into fixing the problems.
Before we go to the next slide, I want to make sure that there are speakers on, that people will be able to hear it, the video. Okay.
Yeah.
So press.
So here's a little clip of a TED talk that Dave did, and I think you'll like it.
So press next, and then go up in the black. There you go.
Healthcare stole the American dream. But today I'm excited to tell you about how regular people, including nurses and doctors, are taking it back by
It's
fixing
about
healthcare.
7 minutes.
And the great news is it's working. Think the economy has recovered? Well, if you look at the middle class, think again. The middle class has been in a 20-year income decline. And remember, most Americans get their health care through work, and health care is the reason that 70% of American families have less than $1,000 in savings. And it's not because employers have been stingy. They're actually spending far more money on employees than they did 20 years ago. The problem is every dollar and then some has gone to pay for health care. Because for too long, employers have badly managed how they purchase health care. And why is it that millennials are the first generation in American history to think that life won't be better for them than their parents? Well, with over half of their lifetime earnings slated to go to healthcare, millennials are on track to become indentured servants to the healthcare system. Every year in healthcare, we pay more and we get less. Healthcare costs are overwhelming us, and it's causing us to lose hope. But hope is actually what I want to share today. I'm going to share how regular Americans are applying common sense fixes to healthcare. It's what America does. When it comes to big societal challenges like civil rights, better food, energy independence, solving these problems from the bottom up is the American way. So I'm going to share how one American is doing it and how it can be recreated in your community and across America to solve the healthcare crisis. Let me introduce to you Harris Rosen. Like any business leader, he wants a fair deal for his business and his employees. Rosen's the son of immigrants who struck out on his own and bought a failing hotel in the 1970s during the height of the oil crisis in Orlando. Working 5 different jobs, he turned things around and had a thriving hotel until the 90s, when the increasing weight of healthcare started crushing his business. Every year he was paying more and getting less. Now, Rosen didn't know anything about healthcare, but he knew it was crushing his business, and he was fed up. So he ignored the so-called experts and set about tackling the challenge with can-do American spirit. And fortunately, all the solutions to fix healthcare have already been invented and proven. It's just common sense, and it just takes some will. And he had will, and he applied that will and common sense to tackling the healthcare challenge by cutting out middlemen who weren't adding value and focusing on prevention and relationship-based primary care and carefully managing high-cost medical issues. Postal code turns out is a better predictor of health outcomes than DNA codes. And unfortunately, healthcare's hyperinflation has been devastating promoters of health, like education, safe neighborhoods, access to good food, clean air, and clean water. Now, it's a different story at Rosen. They know that investing in education is at the foundation of achieving the American dream. So they take money that would have otherwise been squandered in healthcare, and they pay for college for their employees and their employees' children. And if that wasn't enough, they adopted a nearby neighborhood that was crime-ridden and started by investing in daycare, pre-K, after-school programs, and so far 450 college educations. Guess what happened? Crime went down 67%. High school graduation rate doubled to more than, or almost 100%. And the entire cost of all that was less than 5% of what they saved compared to similar companies. And this success is so contagious that they adopted a neighborhood 5 times that size, and they're doing the same thing. Rosen is spending 55% less per capita on benefits with one of the best benefits packages in the entire country. That's about $5,000 per employee per year that can go into the employee's pocket, the business, or the community. That's what happens when you have will. That's how you restore the American dream. And these successes are sprouting up from the ground up all over the country. From small manufacturers to school districts to publishers to large municipalities, basically applying the same common sense things that Rosen did. And you know that if every employer did that in this country and had that will and common sense, it would be like a citizen-driven $500 billion economic stimulus every year into the economy. Those that are trying to protect the status quo, they'll try to politicize healthcare. They'll try to use fear, uncertainty, and doubt to protect their interests. To stop progress, they know that it's nothing easier to politicize or frighten people about than healthcare. After all, it's life and death. But each of us must inoculate ourselves against these enablers of the status quo who benefit themselves at the cost of our health and our wealth by infecting us with this sense that healthcare is too complicated to fix. That is absolutely false. And here's the great news. Former adversaries are realizing they actually have shared goals. For example, in Pittsburgh, teacher unions and management got together, took a fresh look at their benefits approach, and it's amazing the result. In Pittsburgh, kindergartners can have $2 billion more available to them during their K-12 years than their counterparts in Philadelphia, where they're needlessly spending 40% more on health benefits. So in Pittsburgh, teachers are paid better, they have better benefits, and class sizes are 30% smaller. And the great thing is, these solutions are coming from people all across the political spectrum. In fact, progressives are implementing ideas that would be called conservative. Conservatives are implementing ideas that would be called progressive. Each of us has had an awakening. We don't need a left solution or a right solution. We need an American solution. And it's spreading like wildfire. For too long, we've let healthcare crush the American dream. We can't afford 20 more years of income decline for the middle class. No country has smarter or more compassionate nurses and doctors or more innovators who've reinvented this country time and again.
So we'll talk about some of the, get into some of the details of some of the stuff that he was touching on, but just to tell you just a little bit about us, Rosen Care grew out of Rosen Hotels and Resorts healthcare program. We've helped a lot of folks over the years and still continue to help folks. Disney came to us, Whole Foods, Amazon, the Marriott Corp. Just folks are calling us, all the time to maybe give them tidbits of information on how to fix their healthcare programs. It's not rocket science. We've been, I guess, unfortunate and fortunate enough just to have lived through a lot of the scrapes and bruises along the 27-year venture that have just helped us to, make it a little bit easier for other folks to understand and implement.
So I'm going to show you a comparison of, you can't see that little square there, of our plan at Rosen. You see that one? Okay. Our plan at Rosen Hotels and Resorts, comparing it to what your current plans are. And I'm only doing this to show you, when we say comparing apples to apples, I kind of say it's kind of comparing apples to Volvos, because there's a lot of differences here, so I kind of want to show you that. So again, we have one plan and then we have 3 plans, but the majority of your enrollment is in this middle plan. So I just want you to remember that as we're looking on. So as we start, and again, you have the presentation with you, so if you want to follow along, you can look at it. I don't want to go through each line of this because it's kind of monotonous, but As far as the PCP providers, under the Rosen plan, you must come to our medical center if you are an adult. There are some exceptions to our plan with being able to go to an outside primary care physician, but for the most part, all of our employees and their dependents must come to the medical center. One of the exceptions is pediatrics. We don't handle pediatrics out of our medical center. We believe that should be handled by the pediatrician and near their home and things like that, so that is one of those exceptions. But our employees do pay $5 to come to our medical center. The $5, we have discovered over time that the $5 is actually a little investment from them, and we found that it actually works a little bit better than having a no charge. You have no charge when your employees go to your primary care facility. We have toured the facility several times. It is beautiful. That physical therapy room and the workout room are amazing, and so you really like that. But if you don't want to, if you can't go to the medical center for whatever reason, you can see here, the Local Plus plan, that person would pay for the cost. They're paying the discounted rate from the network if they're using an in-network carrier, an in-network provider, but they still would have to pay for that full cost, maybe $75, $80 for that visit, going toward their deductible, and then you have your co-pays of $30 and $35. And if they have a chronic condition and they need to see some specialist, what are those co-pays there? So our co-pay to a specialist is $20. So again, it's a little bit less of a barrier of care than having to reach the deductible or a $60 or $70 co-pay there. Speaking of deductibles, we don't have one. So we have no deductibles in our plan. Everything is set as a designated co-pay, which is really big. We have a very unique population. Everything we do is in 3 languages. So we do everything in English, Spanish, and French Creole. We have a large Haitian population. So explaining our benefits, they understand the co-pays, and they're affordable for them so they can go and access care. But when we look at the deductibles under your plan, now I also work with outside companies other than the Rosen group. And when I look at your deductibles, they're very reasonable. Those are very nice deductibles that would be considered that in the outside insurance world. And then you have your co-pays for urgent care. We have a $35 copay. For imaging, we pay $25 for an MRI. Under all of those plans, those all go towards your deductible again. So they might not have the surgical, not have that service done because it costs them so much. So again, that is one of the barriers to care.
What does it say in the little?
It says, well, we have an out-of-pocket maximum. It's one of my bones of contention. Of the highest it could possibly be is $7,350. That is according to the healthcare reform limit right now. Our HR department seems to think that they have to change it every year because ACA changes that. And so I did put here, it's impossible for anyone to meet our out-of-pocket. The largest amount of money that anyone could possibly spend, a very sick person, in my opinion, is probably about $2,000. If you are hospitalized, our copay is $750. If you're hospitalized twice in 1 year, more than twice, you don't pay for the third time. So that's $1,500. And then all of our other copays are $5, $10, $20. So I don't know why they keep on increasing it every year, but they do, so that's what we gotta live with. Next slide. Our prescription drugs. Prescription drugs is a big topic in the country right now. President Trump even addressed it in his State of the Union address. It's a big thing, and it's one of the biggest spends on your plan. We have a very unique plan. You can say the same tiers that you have. We have a generic, preferred brand, non-preferred brand, and specialty drugs. What you'll notice is that we do not have a deductible for our pharmacy versus all your plans have deductibles, and that is waived for generics, which is great. You guys have great generic utilization. You're at 88% using generics. That's wonderful. But what if they can't take a generic? What if they need the brand name? What happens then? So even for your generics, they're paying $20 for that, $20 and $15. We have a $10 copay for our generics. However, we have a direct arrangement with a partner pharmacy, and they're located everywhere. It's Walmart, it's public knowledge. So Walmart Family, so Walmart, Sam's, and the neighborhood grocery stores. If our employees go to any of those places, the generic drugs cost them nothing. So they pay no copay for that. In 1 year, 90% of our employees' generic drugs were moved to Walmart for that. They understand $10 versus no copay, and we moved it there. So, and we're saving on that program also. So we might be paying a little bit more because we're paying for the full cost, but Walmart has a deal with us for dispensing fees and things like that. We have a very negotiated price. So that's where it's a win-win for both us and for the employees. But our preferred brands, you see at $15, and the highest amount the employee could ever pay is $30, even for those high-end specialty drugs. Versus a high-end specialty drug under your plan is 75%, up to $250, up to $200 on the other plans there. So the exposure is greater there. So what could happen is that if the employee needs that drug, they might not get that drug because they can't afford to pay that copay or co-insurance for that. And what does it cost difference? And I would have chosen a different color if I knew it was going to be black on that. It says under that square that most our employees are in bracket 1. So how much do the employees pay for it? Now, we have 7 brackets, and there's all different ways to enroll employee plus 1 child, employee plus 2 kids, and all of that. And you guys have this half family and secondary coverage and all of that. I wanted to kind of make it really basic for you, so I just did employee only and family coverage, a 2-parent family and with children. So under bracket 1, our base level employees, who is the majority of our staff, pay $16.17 per week for medical coverage. That comes out to $840 a year. A supervisor level for bracket 2 would pay $20.22 per week, which comes to a little over $1,000 per year. Now, comparing that to your plan, your first plan, your Local Plus, right now your employees don't pay anything for that. So that's great. So you might say, well, their plan costs more. Yes, but look how much more they get under our plan. And then, again, even your plan, your Enhanced Local Plus is less than that. When I take the $25 per check and you guys pay 20 times a year, so I annualized it there so you can see that. Then I showed you family coverage. So under family coverage at the entry level for bracket 1, that employee is paying $49.18, and it comes out for the whole year at $25.57, and you can see across it how much the difference is for family coverage under the Osceola plan. So we come down to it, we say how much is it all in for Rosen, how much is it for all in for Osceola? Based on the reports that we got and analyzed, and we've been pillaging through them over the past couple of weeks, we have an all-in number of $32 million. Now, we don't have 10,000 members like you guys do. We have a lot less of people. We have 5,800 members. So 32 million divided by 5,800 is we're almost paying $5,700 a year for our insurance for our employees. And the all-in number for Osceola is $74,845,949 divided by the 9,885 members. So it comes out to $75,72 per member per year. Next slide, sir. So how do we get this? So as far as the funding goes, and again, this is again from the outside looking in, from what we received from the data, as far as how does the money going into funding the school's plan. We have, the biggest amount is from the school board, right? You guys are paying the vast majority of it. So we have a contribution for each person's elections that you have funding in there, and that's a little over $47 million. You also pay for the medical center, so that's an additional $3 million, and then you had to fund an additional $8 million last year, so that brings it to $58 million. You have the employees' contributions for their payroll deductions, how much they pay per check to pay for their insurance, and that comes to a little over $8 million. Then you have retiree premium coming in. So that comes into $67 million into the health insurance trust fund for the medical plan. Now, how is that money going out? So we have some buckets here to show you of where the money is being spent and each one contains it there. So we have our medical center. That's the smallest bucket. We have an $800,000 admin that we're paying to our administrator to run the medical center for us. And then we have about $22,000 of pass-throughs of salaries and equipment for the medical center, bringing that total expense to $3 million. Then we have our medical plan and our pharmacy plan. So our pharmacy is about almost $14 million. The employer, or your plan, is paying a little over $12 million. And then the employees portion with their deductibles and their co-pays are paying about $1.5 million towards that. On the medical plan, we're almost at $58 million spent on the medical plan. Of that portion, $50 million is paid by the employer and $7.6 million is paid by the employee. So again, this is how we get to the per member per year. The all-in amount is $74,845 divided by 9,885. That's how much we get per year. And these numbers were obtained, and I should reference here for you what data that we were provided, that we got that information.
And Carolyn, excuse me just for a minute. I think it's important to note that typically when on-site clinic consulting companies come in, they focus on that admin bucket, okay? They focus on the smallest bucket. We want to get you the best price we possibly can on the smallest bucket. But everybody is ignoring the elephant in the room, which is that big bucket. So, and again, I don't want to get into the great details, but ultimately what we would want to do is try to keep that roughly the same. And this one right here will stay roughly the same at first, but what we want to do is increase your costs here. We want to increase your costs here because every dollar we put in this bucket right here.
It's touch.
Yeah, it is a touch screen.
This is new technology.
But every dollar you put in this bucket will save you a whole bunch of money in this bucket. Want to touch it again?
Try it again.
There you go.
Kind of like your eyes.
So I think that's crucial. Our entire goal is to focus, use all the tools we can to reduce this bucket and this bucket's price.
So here you'll see some of our awards that we have won for our medical center and our overall healthcare plans. We won the Atlanta Business Journal, the Employer Healthcare Hero, the American Heart Association, and then most recently in 2018 we won several awards at the World Healthcare Congress. This was a big deal for us. We won the Lifetime Achievement Award in Health Benefits Innovation, a Lifetime Achievement in Public Leadership from Mr. Rosen, and a Large Employer Award that we won there. Now, after we won the awards, the moderator interviewed Ashley, Kenneth, and Mr. Rosen there. And I hate to say it's another video, but there's a video that a lot more details of our medical center's uniqueness will be provided to you. So,
And good morning. You're watching continuing coverage of the World Healthcare Congress here in Washington, D.C. I'm Mabel John, and I'm so pleased to have three gentlemen join me this morning in the studio. We have Kenneth Aldridge, Harris Rosen, and Ashley McCoe of Rosen Hotels and Resorts. Gentlemen, thank you so much for being here. And we just finished a very beautiful presentation of the award ceremony with the Health Value Awards. And Harris Rosen Hotels and Resorts was recognized during that presentation. Let's start first with you, Mr. Rosen. You started this company years ago, and during that time of operation, you recognized that healthcare needed to be improved for your employees. Talk about how this works day to day. Kenneth Aldridge, that's your job, to really be there and to recognize some of the needs of the employees. What's challenging about that if other companies wanted to replicate a similar model?
What's challenging about it? It's not very challenging. I mean, employers can do this. I mean, they just have to step outside of their box. They don't have to do what we've done, where we're at today. They can start off small like what we did, a part-time doc, part-time administrator, part-time MA, and evolve based on what is their need. You have to determine what is the need of your population. What's challenging for us, 40% of our population are coming from third world countries. That's challenging. We're having transplants. We're doing those type of things that is challenging to an organization from a cost perspective. But if we continue to do what we're doing, where we're controlling 75 to 85% of the cost in relation to chronic care, we save the money over here and then we can use more of the money for the more challenging conditions. So it can be done. It just employers need to step outside the box, be self-insured, get some sort of risk insurance, some third-party risk insurance, and just take that chance.
And
we've done it.
Yes, I mean, transplants, that's ambitious. So in addition to running the hotels and resorts end of the business, you're running a medical facility as well. it
Yes,
sounds like.
absolutely.
And was that your vision, Mr. Rosen?
It wasn't initially, no. I didn't think that we would ever be involved in healthcare. It wasn't a subject that I was comfortable. I did the way we found it. But we've learned in 27 years. And it's not that, it's not that challenging or complicated. And we've created a template. So we have 27 years of experience, and we can share with anyone exactly what it was that we've been through, the challenges we confronted early on, and where we are today. The wonderful benefit is you save money, which is important in today's world, and you create a benefits program that is absolutely superior to 99% of what's available.
Sounds like
So it's the best of all worlds, great benefits and savings.
Yes. Now, Ashley, can you give me a number on what sort of savings, what sort of investment had to be put into this, and what kind of savings are you recognizing now?
The investment that you have to put into it is a drop in the bucket compared to the savings. We have saved $340 million over the last 27 years.
When you compare our cost per provide to the average, right?
So our costs are 30 to 50% less than an identical demographic, and our benefits are far, far richer than the average. So we don't have any deductibles. Our co-pays are very low. 90% of our pharmaceuticals are free. And so what we've done, in essence, and it's very commonsensical, is to lower the barriers to care. And when you do that through lower co-pays, no deductibles, paying people while they're on the clock, while they're getting their care, when you lower those barriers, people will get care. In the traditional healthcare setting, when you have these high deductibles, people say, I can't afford it, so they don't.
Or if they have to pay for their pharmaceuticals, the great tragedy is they just won't buy them.
Right.
And that's
35% of Americans are delaying care because they can't afford it.
Okay,
So it's removed the barriers. Here, more employers are cost shifting to the employee. We're cost shifting back to the company because it makes sense. But we've been able to create the 90% of our prescriptions that are free, and it has increased accessibility. And what do we save? Well, more people are compliant with their cholesterol, with their hypertension and diabetes. Look at the backside. Yes, we might have paid a little bit of money on the pharmaceuticals. Where are we saving on the medical? One person has a stroke, that's $90,000. I think a $2 a month drug is something that we can afford versus $90,000.
sure, for sure. Give me a visual image of what this facility looks like for others who have not had the opportunity to see it in person. How many doctors do you have on site at the facility?
We currently have 4 physicians, 3 nurse practitioners, 1 PA, a chiropractor, a podiatrist, full lab, full radiology, including digital x-ray, ultrasound, DEXA scan, take-home sleep studies, physical therapy, a dietitian. It's 12,000 square feet, fitness facility, full gym that our physical therapy department uses, and then we also have a multi-purpose room where we use it for Zumba, Tai Chi, kickboxing, and spinning classes. So it's 12,000 square feet. But again, employers don't need to do that because we brought some employers in that look at it and say, I can't do this. You start off small, figure out your pain points, create more access, get the hypertension, diabetes under control, and that's going to be 75% of your spend right off the get-go.
And are you finding that the productivity data is clear? That if you have these employees that are taken care of right on site, they don't have to travel anywhere, right? They can walk to the facility?
Most of our employees can't walk. Some of our employees can walk to the facility, but Mr. Rosen pays for transportation. So if somebody's not feeling well at one of our hotels, they can jump in one of our cars and they're taken right to the medical center and on the clock. So again, no barriers.
Right, okay, and you're seeing clearly.
Yes.
that if you have a healthy employee, you're going to have a healthy company as well.
Absolutely. And Mr. Rosen talked about our turnover rate, but absenteeism, presenteeism, we've impacted all of that.
And are you finding that?
Oh, absolutely. I suspect, I don't know this for sure, but I suspect we might have the lowest turnover in the hospitality industry, an industry that turns over like crazy. As a restaurant industry. So we turn over almost single digits. The industry turns over maybe 50% or 60%. And it costs when you have to have somebody meet and then have somebody join the company and go through training. That's expensive. So we save all of that. But the basic premise is so simple. If you keep people healthy, you save money.
Thank you so much for your time today.
And that picture up in the upper right-hand corner, is that a picture of our actual facility?
Oh, okay.
So in the video you heard, we talk about access quite a bit. These are the 5 things that we focus on: access, quality, service, cost, and innovation. You know, there's many times where people will say, well, guys, why do you focus on access before quality? And we say, well, does it really matter about the quality if we can't even get the patient in for the care? No, access is a number of things. You heard us talk a lot about benefits. If they don't have access to their medications, if they don't have access to a facility, if they don't have proper access to urgent care facilities or the emergency room. So all of that is the first foundation, and then we're going to build upon each one of these as we go through the various slides. So what do we learn? We've gotten some of your surveys about you know, the facility and some of the things that your associates, your employees are talking about. They have voiced opportunities for improvement, and some of those are making appointments. We can find ways to improve that. Appointment availability, and even customer service. We also learned that population management, and that's where a lot of employers, and that's where people are finally getting to. You know, the Affordable Care Act is helping people realize that we should have been accountable for our employees before. Well, before we were so focused on, you know what, here's your benefits, go use it when you need it, right? That's sick care. What are we talking about? We're talking about population management. We know that the health facility was basically set up as a episodic care. You have a cold, a cough, you know, you can go to that facility. And again, it's a beautiful facility. We love it. Very envious of your physical therapy department, and hopefully one day we'll be able to have one just as nice as yours. But we recognize we have some chronic care conditions, and you heard on the video, we talk about the national average, about 75 to 80% of your spend is going to be spent on what? Chronic care conditions. You have 883 diabetics, identified diabetics. You have over 2,000 hypertensives. Are they being managed? Yes, you can be a diabetic, and are you under control? Are you taking your medications? Could you afford that medication because of your deductible? If we don't control those chronic care conditions, you're going to spend it somewhere else. Where are you going to spend it? Urgent care facilities, the emergency room, admissions. And we're going to talk a little bit about that with some of these cases. So with this, we also recognize wellness gaps, and those are things that people should be getting. And you hear about the PSAs and the mammograms and the colonoscopies. Those are the kind of things that, from a population health standpoint, we should be focusing on. The costs continue to rise, and again, we talk about the 75%. And to give you some of more of your data, 11 of your 15 high-cost claimants had comorbidities, such as high blood pressure, such as diabetes. Chronic care conditions, if we can control those, we can control the majority of the spend. What the solution will be is what we are looking for is to oversee the operations of the health center. We will work together to change the mindset, to move it away from episodic care and acute care to more of a patient-centered medical home, where we're focused on that individual, focused on that individual's case, diabetes, high blood pressure, high cholesterol, whatever it might be, to make sure that they're getting it under control. We would look to go to each of the schools to educate them about the new culture and the new mindset of population health. because right now it's, I've got a cold, I'm gonna go there. Now, we're still gonna do acute care, but the focus is going to be patient-centered, the focus is gonna be population health. Solution, Rosencare would oversee the operations of the health center. Again, population health is limited. You know, we're going to be looking at the diseases, putting in systems to look at the disease patterns, but also the pattern of the individual. That individual's running to the emergency room. That individual's running to, you know, the urgent care facilities in the community. That individual's not getting medication that they should be taking. That individual's non-compliant with their medications. And here's, we're missing some.
It's not
So
flowing
here,
in, but.
here is gaps specific to your diabetics. And I already told you, you have 883 identified diabetics. And the first thing is, when you're diabetic, you should be checking your blood sugar pretty routinely, right? And with that, you're going to have diabetic supplies. And according to your data, over 705 of your diabetics are not getting testing supplies. So are they checking their blood sugar? 728 of your members are not getting their eyes checked. So that could lead into problems with the eyes, and that's going to cost you, no, it's going to maybe potentially cause that person to be blind and have eye damage, but it's going to cost you even more money to take care of that patient. And guess what? You know what? If they're blind, maybe they're not even going to work for you anymore. So now you've got to replace that individual. Diabetics should be also getting their A1C. That's another measure of the control rate of that diabetic patient. And you have 203 identified individuals who have not had this measure taken. So we don't know how controlled they are. They don't know how controlled they are. Why is it that they're not getting this done? Is it an access issue? Is it a fear issue? What is it? Opportunity. Microalbumin, that looks at the kidneys. So, but diabetics, you can have diabetic retinopathy, the eyes, nerve problems, you can have amputations, you can have kidney problems. And here we have 524 of your 83 that haven't had this checked in a year. What can this lead to? Kidney damage. It could lead to renal failure. It can lead to dialysis. So here we have patients not checking their sugar. Maybe they're saying it takes too long to prick my finger and test it. I've told patients, well, guess what? If you don't do this, how about we send you to dialysis 3 or 4 days a week and for 4 to 6 hours a day? Does that take a little bit longer? But here, opportunity to make sure your associates, your employees, and their members are healthy. Again, gaps in care. You have over 2,000 hypertensives, gaps in care, high cholesterol patients, asthmatics. 50% of your members with persistent asthma went without appropriate medication in the last 12 months. When they have asthma attack, where are they going to go? So if we're not controlling the asthma, if we're not suppressing it with the right medications, they're going to have a reaction. And you have 50%. Is that an opportunity? Yes. Do you have asthmatics going to the emergency rooms? Yes. How much are you spending on your asthmatics? I believe it was about $10 million. That's a lot of money, but possibly opportunities to control that population.
So wellness gaps. So whenever you hear about preventive medicine and promoting wellness, there are benchmarks which at different phases of your life, and depending on what your gender is and your age, you should have certain things done. So I just turned 50 and had my colonoscopy done. And I have unfortunately, I have a good friend with stage 4 colon cancer. So as unpleasurable experience as it was, I did it in honor of my friend. And I knew I needed to, and I was nagged by the medical center, you're turning 50, it's time for your colonoscopy. But we have identified through the reporting that there are a lot of people over age 50 that have not had their colorectal screening. And there are a lot of different ways of having that done now. There's new technology where you don't even have to go under anesthesia and have that whole thing done. There are take-home tests and things like that. Women not getting their pap smears, women not getting their mammograms, and men not having their PSA levels tested after 2 years. Why is preventive medicine important? Because if we take care of it and identify at its early stages, it'll cost us this much, and have been this much affected in that employee's life versus it's caught later on in life when there are bad symptoms going on, well then it's going to be very disruptive to their life and cost the plan a lot more. So for example, preventive mammogram costs between $100 and $140, and a person who has much more invasive stage 4 breast cancer can cost up to $100,000. So emergency room visits. We heard a lot about emergency room visits, and I guess the culture, somebody was saying to us, is that people just go to the emergency room because they know that they don't have to pay the hospital after. And so hopefully we can get that education out there of what the resources at the emergency room are for, and it's not for simple things like bronchitis and strep throat or sinus infection. It's for, severe trauma to your body or severe illness. But we had, so Osceola Schools had 1,783 visits to the ER last year. According to Gallagher's benchmark data, according to like groups, it should be about 1,572. So that's 211 visits more than your average group of your size. Our average cost for the group was $1,919, and the benchmark data was a little over $1,000. So we're going more, and we're spending more at the emergency room, almost double what the benchmark is. So if we have opportunities at the medical center and we get those chronic conditions under control, people should be using the emergency room less. If we educate the employees about the other resources available, that the new culture out there for the medical center, what standalone facilities are out there other than the emergency room, we can bring that number down. If we just bring it down to the national average as far as number of visits, there will be a savings of $404,000. And if we bring that down as far as the number and the number per visit down, that would be a savings of $1.6 million. And so if we do accomplish both of them, that would be a $2 million savings there. As far as prescription drugs, I love talking about prescription drugs. It's probably one of my favorite things to talk about. And us as a country, we love to take our prescription drugs, and we have a lot of them. We did 92,717 scripts in that 12-month period at almost $14 million. Now, the vast majority of your drugs are generics, and that's great. 88% of our drugs that we're using are generics, and the employee should be applauded for that because they've done comparisons, they've done their research, and that's great. So it's 31% of our volume of drugs, but it only represents 2.1% of our spend on drugs. So that's a great thing. The biggest thing that's the talk right now that everyone's talking about in the country is those high-cost specialty drugs. So the specialty drugs are our top 20 highest cost drugs is 0.2 for volume, but 24% of our pharmacy spend. So those drugs we're paying per member per year equals almost $5.7 million just for those drugs. But you see, it's very few people taking those drugs. So that's where we need to focus on those things. And we have some programs built in to our program that can lower those prescription drugs. So if we were to get some contracts that could get those drugs less expensive, then and we're just saying a 25% difference, that's a $1.4 million difference to the plan and to the employees. So they would both, and again, like Mr. Rosen said, so then the employee would take their drug and then they would, maybe help their care there.
Carol, and I'm sorry, I messed up. I was supposed to change that. It's closer to a little over 40%. 0.2% of your meds are costing you almost half of your drug cost.
We recognize that teachers and people that work in the school system, whether they're a teacher or administrator or whatever it might be a bus driver, that there's a lot of stress out there, especially in a place where you have a lot of new students coming in. We have different cultural differences here, and I know a lot of the teachers feel threatened and what they can do and what they can't do, and it leads to stress. So a lot of them, so here's a study from the University of Missouri that estimates that 93% of elementary school teachers have, they're experiencing high levels of stress. So stress is something that not only affects you mentally, right? It affects your sleep patterns and things like that, and you can't think properly. But then it also transfers to the physical being. So what happens when you have a persistent anxiety is cardiovascular disease, heart disease, high blood pressure, abnormal heart rhythms, heart attacks, and strokes if it's not managed well. So what can we do at the medical center to help with this? Well, one, the patients would work with their providers on the physical symptoms of their stress, and whether it's certain prescription drugs or helping them and consulting with them on different physical things they could do, whatever it might be. I know you guys have a really nice EAP program here, and we would probably work with your EAP vendor and maybe bring in-house a counselor that can be there where employees can just, because I don't know if you've ever done the EAP. I'm a huge proponent of the EAP. I used it myself. You kind of get this whole directory, and then you have to call and leave messages. It's kind of hard. But if you had one on site that they could call and make an appointment, wouldn't that be nice? And then maybe offer more stress-reducing exercises like yoga. So you have the most amazing facility there. We saw the bike that you make the shake with. Smoothie. Have you guys seen that? Make the smoothie? Ken and I, we want this. So yeah, we don't have that. We have a water cooler with us, So, but to maybe incorporate more of those classes. Maybe we can promote classes even on site at the schools to help them release some of their stress. So here is our partnership. How can we make this partnership work between the school district and Rosen Care? Again, as Ashley mentioned when we started, that our employees are out in your community. That we have 442 full-time associates that actually live in Osceola County, and so it's them and their families. So, they were taught by you, and you're actually teaching their teachers right now. So it's an investment on our side for our employees also. So the traditional healthcare model really is diversion of care. So rather than going to this doctor, you come here to a medical center, et cetera. And that's really, they do episodic care. They treat you for, strep throat, bronchitis. Here you go. Here's your antibiotic, and you're on your way. Our model is an integrated healthcare center model. The first thing it's called is your medical home. So your medical home is really the hub and a wheel where it really controls and steers everything. So it's a member-centric that is delivered with service background. So again, we hang our hat on hospitality, so it's service with a smile. So it's diversion of care, of course, population management, care coordination, and comprehensive wellness. So what do we deliver? Wonderful service with a smile. We train and integrate that culture into the employees that work there. It's not acceptable to be, give poor service to, because that is your customer. So your customer, although they're an employee, they're not paying anything, that they're your guest, and you treat them appropriately. We lower cost trends, improve health outcomes, again, that population management, improve member and employee health once they're under control, etc. Improved employee satisfaction and retention. That's really a big thing. When we talk about if someone, what turnover does, having to train somebody and have to go through all of that again, and if an employee has to take days off work because they're not feeling well, substitute teachers and what that costs for you, it's a huge amount of time and money. Improve productivity and efficient use of all resources. We want to use everything that you have available to you. Again, that wellness center is beautiful. We want to use it, okay? So here is that hub, again, saying all the different services on the shared site. So again, the main focus is primary care and urgent care. We're still going to do the episodic care. We'll still do those things that, you have strep throat, you have bronchitis, fine, go in, but we're really going to focus on the overall being. The ancillary service, the blood work, the EAP we mentioned, care management and coaching, wellness and preventive care, occupational health, specialty referrals, and your physical therapy, all done together with service with a smile. So Ashley's going to go over shortly how we make this plan work, but when we put our values into the Osceola Schools medical plan, and we have the participation that we would like to have, or that we want, we know that we can save you millions of dollars. We know it. We've done it for 27 years. This doesn't mean that you need to adopt our medical plan. We've talked to some groups before, we said, oh, our employees will never like that medical plan or whatever. Look, we didn't talk about anything about adopting our medical plan. We're going to work with your plans that you already have in existence. We've been doing this for 27 years. We've saved over $340 million. This will bend the trend for the school district that you've been suffering from each year. So here's Ashley.
Thanks, Carolyn. I want to mention just one more time about the service with a smile. Listen, that doesn't necessarily translate to savings, but it certainly has a way of attracting people and getting them to want to come back. Mr. Rosen opened up his first hotel 45 years ago and has focused laser-like on service. Yeah, we drop the ball sometimes. We're not perfect, but let me tell you what. You can ask anybody who works for Rosen Hotels, and they will tell you it is all about the service. We've got a lot of hotels in the area. They can go to a lot of other places, and we, again, cut our teeth in the hospitality sector, and we are all about providing great service. How do we get paid? We think it's important for that our fee includes an incentive to reduce your overall cost, so we can get the savings back to the school district. So right now, your administrative fees are about $800,000. That's okay. Right now, your administrative fees are about $800,000. That's actually priced below market value, but Florida Hospital has the distinct advantage of, remember that last bucket. They can make kind of money in that bucket too, and we don't have that dynamic. So it is priced below market value. We would charge the same price, but charge 12 cents for each dollar of savings. And there would be a minimum of $190,000 in that savings. I don't think we will have to go there to enforce that minimum if we will just act on many of the solutions that act on some of the many solutions that we'll bring to you.
What's in that black box says areas of opportunity for savings to be identified, mutually agreed upon, and implemented. So we would agree on the areas that we're going to test for savings and then watch them from there.
Yeah, your pass-through cost, again, I think I mentioned this earlier, will be roughly, ours would be roughly the same as theirs, but we ultimately want to increase your cost in that bucket, because net at the end of the day, you're going to save a lot of money in those last two buckets if you pour a little bit of money in this other bucket. And that pass through, I mean, none of it goes to us. It's pure pass through and transparent. So we can't do it alone. It's truly a partnership. Our programs will only work when members come to the medical center and work with us on our programs. We will come up with many innovative ways to get them to come in and to get them to want to do what we want them to do. Listen, it's not easy. We've got employees. I mean, my wife doesn't want to go down to the Rosen Medical Center, but we've got ways of, coaxing her in there and getting her to get what needs to be done. So again, if we can't get you're going to have to make some tough decisions along the way. If you can't, make some different decisions and do some things differently, it won't work. It won't work. Certainly won't work optimally like we want it to work. Go ahead. It's not a quick fix. Patience is going to be crucial, and I know that I'm guessing I used to work in the government sector, and I know that there's a lot of pressure from citizens wanting things to happen overnight, and it puts y'all probably under intense pressure. But patience is crucial. It's a big ship. It's going to take us time to turn it around, but I can promise you that if we can implement some of the solutions that we're talking about, you will be in such a better place in the future. You'll be very glad that you did this. And our doors are open to you. If you don't quite believe that we saved all this money, we'll give you more details to show you that it really does work, and it's not rocket science. It's mostly commonsensical. And I think
Yoga
that's
classes
it.
for the board is what you're saying?
Spinning classes.
Spinning's our favorite.
Hot yoga.
Yeah.
Spinning classes with our instructor, his arms are bigger than my thighs.
But I know that was tough to go through. That was, we were trying to simplify it the best we could, but we just wanted to get down into some of the details.
Just members of the board, when Mr. Thacker had the meeting, one of the things that was driven were there were a couple little things I'll just throw in. One, we would establish, if we went this route, agreed upon measurement metrics, and the reporting to the board would be directly from them, not our staff members or anyone. They would be accountable to the board. And the reason Mr. Thacker, the chairman, wanted this so detailed was understanding the complexity of what's out there, the buckets, et cetera. So
This helped to me, what does that just help me with, which is kind of how we got to this point to share with you, was when it is extremely granular, but when you start to see the examples, it starts to kind of make some sense on where you can say, we even went to some granular, like the prescription savings on medicine by medicine. Humira was one, I don't remember what it was, but it's massive. We spend $1 million or something on Humira. You see advertised, I don't even know what it is or what it's for, but they've got a way to buy that for about half of what we're spending. Why does the patient care? If you get your Humira, you get your Humira. So that you started to see some very simple things that can start to add up to several $1 million in a hurry. The other thing that really got me, because this, you may remember, back when we first went to the healthcare clinic, one of the things I kind of harped on is you take bucket 1 and 2 up there, and they were going to manage $5 million, I don't know if y'all remember, worth of medical cost in there and save money. So if we can if we can save money on $5 million, let's get $10 million in there, or let's get $15 million in there. And that's kind of what they were talking, that when they kind of showed the bucket and said, we want to increase the size of our cost that's the pass back through to you, because we're going to treat more of the things. And that was what they kind of got me.
they're disrupting the medical model.
Yes.
It needs to be disrupted, and I applaud you guys for
Thank you.
what you're doing. No, it does. It's a racket. So you say patience, and I understand and I respect that.
Not real estate, no. I'm just
Real estate is the American dream, baby.
I own real estate company.
You say patience. Kind of give me your thoughts on what does patience mean? As you guys sit, you've looked at, you've analyzed some of our numbers, you have a pretty good understanding of who we are, what we do, where we're broken right now with some of these areas. Maybe just paint a picture for me. We would see probably over the next 6 months this, next 12 months this, next 24. How do you envision some of this?
So it's a bit fuzzy. It's hard to really wrap your head around it. But I think we'll first unit cost savings. We'll get some unit cost savings. So in other words, if someone is out there going to a doctor in the community, okay, and it's costing X, and we can have them come in and get their visit at our medical center for half of X, you've got unit cost savings there, right?
But we're not going to cut them off initially.
Right. No.
Maybe never.
Yeah.
And
It's not an all or none, I guess.
your drug costs, okay? Your drug costs, it's very objective. I can show you, hey, you're paying X for this drug. We can get it for, 10% less, 20% less, 30%, 40% less. So those are going to be a little bit easier to, as soon as we implement, we'll start seeing those savings. Your bigger savings, okay, are going to come from fixing that uncontrolled diabetic and controlling them.
Getting them into the medical center,
Are there someone that's pre-diabetic, keeping them from being diabetic? And it's just a fuzzy, when will that take place? It's hard to say, but intuitively, we have just proven if you stay in it for the long haul and you fix that person, you're going to save a lot of money. I mean, we know that average cost of an uncontrolled diabetic versus the average cost of a controlled diabetic.
I just want to add this here because, again, I mean, you guys know what you're doing. I don't want to say that, but I mean, I remember sitting here 4 years ago and having this same exact conversation. I mean, almost verbatim, what you're saying today is what the folks from Florida Hospital were saying to me, whatever it was, 3 to 4 years ago. I know there's a difference. You're not in the hospital business, and that's the big business. That's the big difference.
Yeah.
I get that. But again, I mean, when I sit and watch this, I'm excited about it. Don't get me wrong.
Yeah.
But I really, I do, and for Ken and everybody as well, I heard this 2 years. I heard patience. That, hey, we're going to have a spike in cost for 2 to 3 years, and then we're going to see it go down. I heard, hey, we got to get these diabetics under control, and having a health clinic is going to help that happen. None of that has happened.
Yeah.
And so, and that's, I just wanted to put that out there.
Mr. Booth, I will tell you, I wasn't involved in the first contract. One of the things that I'm adamant about in the contract is that there'll be very defined metrics where you're seeing, where if somebody comes in and says there's been a 1.5 million spike this month, you're going to see where did it happen and why did it happen, as opposed to what I've watched, there's been a spike and everybody's kind of wondering. But I think the key is to do a different type contract where, one, there's an incentive, and two, there's very measurable things that the superintendent can be looking at, and you're getting briefed directly by these people on, here's what's happening. All right, we've got 800 diabetics, what have you moved? I mean, and see what's actually.
I just don't want another board to be here 3 years from now. And I don't think they will. But again, I just, have that
It's the
reservation.
agreement.
That we had the same conversation with Florida Hospital, now we're having with you guys. 3 years from now, where are we at again?
It's a great question. I completely.
I know I'm putting you on the spot.
No, that's okay. I think that's good. I mean, we don't mind that. I think if I were in your shoes, I would absolutely be saying the same thing. Who are these people? I don't really know them. Who are they? I mean.
Well, one thing I want to reiterate.
But bear with me for a minute. Managing that center, again, is the pricing is below market value, okay? If we can't make money on savings, we don't want to be here. It's a loser for us. And so I think that's probably the fundamental, I think there are a couple fundamental differences between us and just others out there, but we've got an incentive, a serious incentive to drive down cost.
Your current contract, can I just say, Mr. Ruth, there's not one thing I found in your current contract that literally, it talks about providing services, but there's no data metrics to measure anything. I mean, at all.
And excuse me, just one more. And we will have to talk about metrics later because, listen, if you had a bad year last year and you were destined just to have a good year this year because last year was just so darn bad, it's not fair for us to be incentivized for that. So you're not going to see us, hey, your cost went down $4 million because we didn't have anything to do with it. We want 12 cents of each dollar. No. And conversely, if we're fixing those diabetics and doing all that good stuff, and you have some sort of, a catastrophic situation, a motor vehicle accident that we couldn't have controlled, we don't want to get, we don't want to get dinged for that.
So, I mean, it's your belief, if you don't mind, Mr. Weishaupt, it's your belief that your innovation, your access, that difference is going to make the difference again, because we talked about diabetics last time, and that's a big problem, and we're going to fix that. Hey, we're the people that we're going to fix that. We're going to get the people in. We're going to do preventative care. We're going to make sure. I mean, I've heard all of this. 3 years ago, 4 years ago, whenever that was. 4 years ago, thank you. I heard all of it.
Yeah.
And so, I know we can't answer this question today, but I mean, it's your belief that your innovation, your increased access to what we have today, that those are the two keys that are going to drive those numbers and drive those savings.
Coupled with your partnership, you're going to have to make some tough decisions.
Sure.
Okay. And listen, we might ask for a very tough decision, and we meet somewhere in the middle, and that maybe cuts that savings in half. But it's going to require that.
I know we keep kind of beating around the bush of referring to the bargaining that has to happen through all this. But look, most teachers that leave the industry, the first thing they say to me is, "Oh my God, I didn't realize how good the health care was at the school district," even though it's not what it was 20 years ago.
Yeah.
They say, "Oh my God,
Yeah.
I can't believe how good I had it at the school district." When they go into a private industry or they go into their own employment and then have to purchase themselves. So I get that a lot in the community. So I think teachers are figuring it out now. I mean, I know we'll have whatever happens, whatever. But folks are figuring it out. So I wanted to go back really quickly to the point where you said, "Oh, we're going to work with the 3 plans you already have." I'll be honest. We've mentioned this before in our privately, and I'll say it here: blow it up if you have to. Let's win this thing. I'm all in. Let's win this thing.
Well, we didn't want to be totally, offensive and say, whatever. But we want, our idea right now is to kind of work with the partners that are already in place, and then I'll put our values in there, and then as we
Thank you, Mr.
get
Booth.
married.
They kept asking,
I don't think any of us.
Mr. Thacker and me and the superintendent, how willing is your board to basically blow it up? And we said, we think they're pretty ready to make the tough decisions.
But when you talk about the how fast or the time period in the patients, Kenneth is a medical professional. I'm a benefits person and doing education out in the field and things like that. We have to change the culture of the medical center, and then we have to change the perception of the medical center out in the schools. From what I understand, the perception is they're difficult to work with, they're not friendly, it's hard to get appointments, so we want to go out there saying, it's a same facility, but new and improved, or whatever it is, and go out there and welcome them to come back for a second time.
Just so you know, our board has taken the stance, and part of our strategic plan that this board put together has a lot to do with the customer service that we provide to our clients, which are parents and students. So that's actually a part, and we've taken the lead from your industry to help our employee, maybe not Rosa directly, I don't know the other company that we use, Ritz-Carlton.
Yeah.
Right? So taking, what you
Pleasure
do in
to serve
your
you.
industry to help our, folks that are front desk at every school that we have. And so that's part of what we pride ourselves
The one person who greeted me here was
too.
very nice, she's very helpful, and called
We
Sarah.
pride ourselves
secretary.
too on being a district that really understands that the relationships we build between our front office folks at our schools and those interactions they have with our parents are very important ones.
Correct.
One data point.
And your parents are our employees.
The first time I talked to these guys, correct me if I'm wrong, because this was a little while ago, they have 10 providers, that'd be your nurse practitioners and your doctors, basically, for 5,000 employees.
I put
We have 5.
So really that model would give us around
5 providers
18 to
for
20
98
doctors is what we really need to provide the
And they're
access
saving money.
that you.
So it's not only about the access, it's about the quality. So the national average right now, most physicians or providers are spending about 7 minutes with a patient, right? Because they got to see more patients, their reimbursements are cut, those type of things. We've changed our model where now we're spending 30 minutes with a patient. If we have more time to spend with the patient, we can listen to the patient, we can do the population health management, we can do all of those things with that patient instead of making them come back. That's why we have 10 providers. We've changed our model to support and care.
So let me ask this. I mean, we know that we can't, I mean, that's part of the struggle. And I mean, originally the design, we know we can't see 10,000 people in our one clinic in the middle of the county, right? I mean, it's just not, I don't think, possible.
Yes.
Certainly with the way everybody's spread out. I know folks in St. Cloud, folks in Point Santa, it's different, right? So if we had 20 doctors, right, to match your model, where are they going? Are they going into the schools to see teachers? Are they going to smaller satellite offices? I mean, I know these are questions for another day, but that's kind of where.
But yes, and yes, and
Okay.
how about the doctor stays at home and sees their patients via telemedicine? Those are the type of innovations that we can bring to the table for your organization once we understand all the pain points.
They talked with the chairman about mobile. They talked with the chairman about putting either a storefront or a trailer down in Point Siena, so you could reach, because you could reach people, and looking at the county. In fact, I have for you here, we did for them, this is a scattergram that shows the zip codes of where all our people live, which would enable them to go, this is where it needs to be.
But seriously, I mean, I've thought of this before. I was not anything that crazy creative, but we have a nurse's office at every school. We have a locker room, you know, at every middle school and high school. I mean,
why not?
Why not?
Yeah.
You know, I mean, I think a teacher is still going to work for that cold, or that teacher that you want to go prick their finger and get their blood. You know what I'm saying?
Exactly.
Or you know, hold them down and stuff the diabetic medicine down the logic, and you don't do that. But you know what I'm saying? You essentially, you know, we have all of these facilities across the entire district. We have you know, 50 some odd schools.
But you're exactly right.
Why can't they, part of that, be part of the solution?
You're exactly right.
One of the service models says is to use all the resources that we have to our greatest extent. If we have resources, that wellness center, and I said there's one class a day at night being done there. There could be classes in the morning, there could be classes at noontime, there could be all different things going on there. If you have resources, use them to the best extent. If you have it and you don't use it, then you get rid of it.
And one thing I wanted to mention, kind of getting back to the savings, is there's a kind of a monster out there that's just hard to deal with, and it's called inflation. Okay.
Sure.
So almost in the $70 million range. You guys are staring down the gun of a $4 to $5 million a year in inflation. So if we jump in there on a unit cost savings and quickly save you $2 million, we'll be at this table next year. And someone, maybe not you, but someone in the community is going to go, why did our healthcare costs go up $3 million? So I think we need to just be sure to set everybody's expectations on that.
But we understand.
Yeah. Can you talk about that?
Hold on 1 minute.
Go ahead.
I've been waiting very
He has been waiting.
Oh,
I didn't interrupt you. This
I'm
guy
fine.
is all riled up.
Yeah.
I'm good now.
You're not right.
I'm not angry.
You're usually the one around.
So, first of all, I have great respect for Mr. Rosen and for your company and who you guys are, what you do, and what you have outlined and where you've been able to be very effective in finding the right ways to save your company and provide better benefits and outcomes for your employees. Nothing but love and respect for that. I also am of the opinion that these are the type of conversations that people need to be having, because I do believe that when you get outside and you get into the private sector and you start looking at being nimble and innovative and removing the restraints that sometimes other entities might operate within, that's where you really start to see significant gains and big wins for everybody. You touched on tough decisions, and I think we probably already hit maybe what you were talking about with what Mr. Booth was saying. If that's what we're talking about when we say tough decisions, plan design changes and really looking at how do we really flip everything on its head, if you will, to really redesign how we go about providing this type of care to our employees, I'll just tell you flat out, I have no problem with that whatsoever. I don't think you're going to have any problem. Can't speak for these other guys, but you've heard at least 3 of us say that's exactly where we've been, exactly where we want to go. The other thing is that those tough decisions really come with an understanding of the tough realities that we all live within. And so We understand that, and we get that there are decisions that all of us have to make, not just as a school district, but us as Americans, us dealing with this system that we're trapped in the middle of, that until somebody like your company or a board like ours or otherwise is willing to say, we know this isn't working, we know it's not right, and we know we can do better, and we're not scared of what people think of what we do because we know that the results will bear out exactly where they need to. That's how we move the needle on these things. And so I'm 100% on board with that. There's no hesitation whatsoever. A question I had, though, is I know you have RosenCare. Have you guys done this for other organizations, or would we be the first ones outside of your corporation to be doing it for?
You'll be the first one for us to do it at this level. I mean, we've helped a lot of people go,
And
hey,
for
you
money.
need to, yeah.
Which, by the way, is fine. I mean,
Yeah.
you have to start somewhere. So
Yeah.
there's no judgment in the question.
No,
It's
no,
just a-
absolutely, but I just want to kind of give you kind of just a little bit of background. I mean, we will, and kind of getting back to just kind of saving the country and doing the right thing, we've done a lot of this stuff over the years just altruistically. You know, our thought was if we blab our mouths about what we're doing enough, somebody will pick up on it and do it, and then that will cause an exponential kind of a groundswell type thing. And so most of the stuff over the years have involved someone coming in, and we might just tell them, well, here's what you ought to do with your pharmacy, or here's what you ought to do with this, or here's what you ought to do with that. But this would be the first one that would take considerable time from certainly the three of us.
From an operations side, taking this on, I mean, we're a larger organization than yours. Does that then that mean that you guys have to expand your operations to take this on and deal with that as well from an oversight and management standpoint? I mean, taking this project on, I have to imagine, puts an additional layer of strain or growth within your own operation to be able to take it on. Am I correct?
We're managing that situation. So we will set it up where we're still able to do our jobs back at the office, but provide plenty of oversight to be sure it's run to Rosen standards.
And we will hire accordingly.
Sure.
So if we need to hire my replacement, who's doing currently run the benefits department, then we'll do that. But we have been, we've agreed to, and Kenneth and I have been dealt these numbers. We're very familiar with it, and we want to help. We met Lauren, who's on maternity leave, and we kind of had a little. She was in tears.
Yeah.
She wants to help the employees, and she's like, but they don't come. They call me frustrated, and so we want to help. So.
I should say
I'm
one
the driver.
thing, because Mr. Rosen called me and said, I just want your board to know, and your superintendent, I am not going to have this thing embarrass anyone. And I know for a fact the reason he agreed to let them do this was solely because it was for a school system in his neighborhood, in his community. He's been offered tons of other companies and said, no, 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 but he sees this actually helping.
Yeah, I have no doubts about any of that. I mean, just from my own personal opinion and perspective, but they're the right questions to ask and understand, and it's the right way to begin the conversation with a larger group that has to make the ultimate decision. So I'll yield back.
No, just back to when we started this several years ago, one of the things I kind of harped on was consistency in the care staff. I don't know if anybody remembers, but very first time I went in there, there was a doctor in the meeting with us, and I started asking how long your providers have been there. And some of them have been there 5 years. Where are your provider in terms of longevity, roughly? I mean, I don't know the number of days.
Probably 6+ years. I mean, we have some new ones just because we've changed our model that we brought on some more nurse practitioners and PAs. But no, we have that longevity we had when they
You don't have a lot of turn.
No, I mean, it's the model you guys have created and our model. It's the providers are there to take care of patients, and they want that. They don't want to have to deal with the insurances and the other type of problems that they have in the real world, or the overheads that they have to deal with. This works.
It's very liberating when we talk with them after they've been there for a while. We tell them what to expect, and then when the expectations come true, They really appreciate it because they got into the healthcare business to fix people, and then they learned that it was kind of all rigged, and they couldn't spend that much. They had to go from spending. They probably want to spend an hour with patients, and they're spending 7 minutes or less. So they get a kick out of working there. And I don't know if they're whistling to work every day, but they, compared to the conventional healthcare setting, it's just they're very thankful to be there, and it shows with a smile and a good relationship.
It was exciting. I was coming in this morning. Lauren, the passion in her eyes is something that at least drove me. But coming in this morning, I heard about some of your students that might be going to Carnegie to play, and that they're struggled with finding the finances. And I sat there thinking, we might be helping find an opportunity so that you don't have to worry. So those kids can go to Carnegie and represent.
Speaking of which,
Osceola.
should the board reach agreement, I have served notice on them that there is an expectation that they would work with the superintendent to adopt a school in Osceola County, much like they have in Orange County.
Oh, we adopted a neighborhood, yeah.
Yeah, it was a neighborhood.
Yeah.
Very neat.
Start with a school.
I'm sorry, guys,
that
but
would
if
be
you
Mr.
want to work
Rosen.
with us,
You guys
let's.
can adopt Poinciana. It's
Jay's gone, but we got
47,000
Frank.
Yes.
I want to
Any
thank
other-
you. I just want to say thank you. I know maybe everybody can finish up, but I do want to say thank you for taking the time. And Frank, if you could, and I know you guys could see Mr. Rosen as well. Tell him thank you, truly for even just for offering and sitting down,
Yeah.
looking over the numbers without
We-
any
we-
guarantee.
we learned a lot.
Of anything
We learned
that's-
a lot.
and about any guarantee that's going to happen. I think we're on the school board because we want to make a positive difference for education and Osceola County as a whole. And I think we have over the past 3, 4, 5, 6 years. So I appreciate somebody has that same passion
Yeah.
to do the same thing as what our passion
And
is.
this
To
was-
make our community better.
I did bring some copies of one of Dave Chase's books.
I saw that. I was wondering
has
if I could
a-
read that or not.
Sure.
Yep.
So I brought a couple copies here.
She'll be back in the morning.
No, I'll give it back.
Yeah.
You need to read
I
it.
brought some.
I'll donate it
If
to the
you read
library
it-
at Harmony High School.
If you
How
read
about
it,
that?
I'll give it to you.
In
If
St.
it's
Cloud.
gonna go in your back seat with the McDonald's fries, then maybe not.
It's a picture book. He'll be all right.
I'll make it there. Is there Philadelphia Village?
Clearly today was not to make a decision, it was just to
Yeah, to
kind of
get that real estate
calculate
thing.
alternatives. So thank you all very much. I know you spent a lot of time putting this together, because I've sat there with you a couple times on some of our issues also. I appreciate your listening and hearing, and kind of addressing what some of those hot buttons
We
are.
really enjoyed it.
Thanks for having us out.
Very grateful for it.
Thank you.
Thank you.
Thank you all
You
very
bet.
much.
Thank you.
And we will stand adjourned.
Thank you, guys.